Hey guys, Dr. Lester here, and I wanted to take a quick second to explain to you a little bit about the difference between type 1 and type 2 diabetes. This is continuing our blood sugar series, as you can tell, and this one is a little bit, I'm using it as a precursor to talk about where we're going, because most of the stuff we're going to be talking about is type 2 diabetes or insulin-dependent diabetes, specifically related to metabolic problems. So let's hit this. So type 1 diabetes is something that you are born with. This means that your pancreas is having a hard time, for whatever reason, releasing insulin. And this is significant because these people have to take insulin because they are unable to produce it for themselves. This happens very, very early on in these people, and it is very obvious as a child. Now, there is some argument as to whether or not there was something in the womb that happened, in the development that happened, or in early exposure to what they did or did not eat early on. That is yet to be seen. We're not going to go into that because it's very complicated. As far as type 2, which is really where we're going to be focusing on, we are looking at the two different types, which is going to be the insulin dependent and the non-insulin dependent of type 2. Type 2 diabetes is a metabolic condition where the blood sugar is too high, and so insulin is not able to respond appropriately, or it does respond appropriately, but it's being ignored rather. So this is all a result of too high blood sugar. And as the blood sugar remains high, as we've talked about a little bit before, as the blood sugar remains high, the insulin starts ignoring it because it's not hungry anymore. So this is when we start traditionally, I guess, treat it with insulin and they become insulin dependent, but we will challenge some of that notion later on. But for clarification, type 1 is something you are born with. Even though they are insulin dependent, it is different than type 2 insulin dependent, which is something you've developed later in life. Usually you see type 1 as a kid, and type 2 you don't see until usually as an adult, but with our poor diets in America and worldwide now, we're starting to see younger and younger kids have this, so it's starting to get a little bit more confusing. But type 2 is diet based rather than something, a dysfunction in the organ. I hope that helps, guys. Thanks.